Hello, I'm Andy Jones, and I'm a physical therapist here at Innovative Services Northwest. And I would like to answer a couple questions today that people have about therapy and the services we provide here. Are all therapy tests standardized, or do they depend on the therapist? So the testing itself that we do when a child first comes to receive therapy is standardized. Those are across the board the same tests over and over. However, once we get the results from that test, how we decide to treat whatever needs to be treated and go from there is individualized. Every therapist has their own technique, every kid has a unique need, so we try and tailor everything to each child. What is the difference between physical therapy and occupational therapy? So a lot of overlap between the two. The easiest way to think about it is that physical therapy handles big movements, so jumping and running and going up and down stairs, things that take kind of our legs but kind of a lot of our big muscles. Occupational therapy focuses a little more on fine movement, so writing with a pencil, or being able to eat with a fork, or tying your shoes. So a little more skills that take some coordination. Occupational therapy can also really help with some behavioral challenges, working with kids that have sensitivities or struggle to communicate. Occupational therapy gets more into that aspect of behavior as well. Does my child really need to do the home exercises? So when you come into therapy, we want to do exercises here and we want to do activities that are going to help. But obviously only 1 to 2 hours a week of something doesn't add up to a whole lot. But if we can have a child and their family doing exercises and activities at home, that multiplies the effect that we're going to get. So when your therapist asks you to go home and do some exercises or focus more on some skills, we really appreciate it when that happens, because it just makes progress go that much faster and we can obtain that much more in the same amount of time. And half of it is just making sure that our patients and their families are being active together and getting out and having fun. Why is therapy important? So most kids kind of progress in their own timeline and figure things out as they go. Some kids just take a little longer than others and kind of need a little bit of a boost along the way. So therapy for children is all about making sure that we're reaching the milestones in the timeline that we want to see them, and offering just any kind of tips or tricks to make sure that kids are either meeting those milestones or doing whatever they can to be as close to it as possible. Some kids aren't going to be able to do everything just based on what their diagnosis is, but we can always work on either getting better at one skill or trying different things to make sure that they're just able to enjoy life as much as possible. How long does treatment usually last? So a session itself generally doesn't go more than an hour based on attention spans, and we're working really hard sometimes and it gets tiring, so we can't really go all day. With that being said, it depends on the kid how long we end up going in total. Some kids within a few weeks kind of have a skill figured out or have made enough progression that we think, okay, you're good to go, and come back if something else comes up. Other kids, just depending on their diagnosis, it's going to be a whole lifetime of working on skills and trying to make sure that they are progressing as much as they can. And in that case, we really kind of tailor a plan that works best for each family. What does physical therapy provide for my child? So the goal of a physical therapist is to help each kid and each patient make sure that they're achieving their best quality of life as possible. With kids, that generally means making sure that they're able to play on the playground with their friends, take care of themselves, get up and play just like anyone else. So physical therapy provides a resource, a professional who can provide your child and your family some tips and suggestions and skills on how to continue to progress and just be able to enjoy life as much as possible.